the first question is going to be, do you believe that the healthcare system needs fixing? And if so, what changes would you like to see?
Well, on healthcare, Josh, that's an excellent question. As with other issues, I want to provide an America First solution. First, I think it's critical that we bring the manufacturing of our vital drugs and equipment back from China, so our citizens' health is no longer dependent on a hostile foreign power. And one of the major drivers of healthcare costs in this country is that so many illegals are using our emergency services as free primary care providers. These costs are then passed on to the local residents in the form of dramatically higher healthcare bills. And the biggest beneficiaries of this system are the businesses who employ these illegals, pay them criminally low wages, and provide no health insurance, and then offload the healthcare costs onto the hospitals, who then offload them onto all of us. I will fight to change these laws to require hospitals to report non-paying illegals to ICE, and will increase criminal penalties on employers who hire these illegals.
All right, that's awesome. Thank you. Next up, Charles, you get to answer the question, and I'll repeat it.
Same question?
Yeah. Do you believe that the healthcare system needs fixing? And if so, what changes would you like to see?
Well, for the first thing, we need to get rid of Obamacare. Before Obamacare came in and Hillary Clinton and Obama got their hands on it, they wanted to take over 1/6 of our national economy. Now, before that time, I could go out and buy a policy of title insurance for me and insurance for me and my wife for a few $100s. But now I had one man tell me that for his family and his secretary, it cost him $1,500 a month. So we've got to get rid of Obamacare. We've got to start back with the freedom with the insurance companies competing and for our business. And this is the best thing that we could do for it. And I apologize for going over a while ago. It got away from me. I'm sorry.
You're fine. You're fine. We understand this is very important. Everyone has a lot to say. And so next up is Jake Merrick.
It's asking me to unmute every time, so I'm having to do that. But I absolutely believe our healthcare system needs to be reformed. And I think it does start with repealing Obamacare. You know, with Obamacare, it created $1.8 trillion in new healthcare spending, and it uses cuts of Medicare spending to help pay for it. On top of that, millions of Americans have already lost health coverage because of Obamacare. So it's been a disaster. If there's anything good, I believe it is the pre-existing conditions. My wife has a pre-existing condition, makes it very difficult for her to get health insurance. And I know multiple people who experience the same difficulty. So I do believe there needs to be provision in the future for pre-existing conditions, but Obamacare needs to go away. We need to keep healthcare in the free market. The free market ensures competition among doctors, increasing quality, reducing overall cost. But one thing I would like to add is I always want to emphasize the preventative health. And, you know, you can't legislate personal responsibility and you can't force people to take care of themselves, but we can incentivize that. We can incentivize businesses and schools to teach good habits and good health care for themselves. And yes. I believe that we'll reap a lot of benefit for that later on. So I know
okay. Yeah. Okay, thank you. Thank you. All right, next up is Shelli Landon.
Yes, I believe that we should revoke Obamacare. And I also went through a health battle myself several years ago. And I discovered that most people in this nation are not able to get the care they need in the area of lymph cleanse, lymph medical understanding, lymph analysis. There are very few physicians trained to the depths of what that needs to be taught and revised in our medical schools. And then I learned that in the oncology industry, many times, unless there's a tremendous breakthrough instantly, it takes an awful lot of money and time to upgrade what is taught, the school books, the textbooks, the text. And then you get people that graduate that go into the medical field and are not acquainted well enough with new innovative types of technology. So that's an area that once I was able to be blessed by that, my life turned completely around. I was not taking chemo or radiation, survived the cancer. I have all the health in the world and the vitality. Nobody can believe that I'm operating at the level I am without any severe damage left over. I also believe that we need to go all American. We should not have any of our pharmaceuticals manufactured overseas.
Again, we're a little bit over time. There's another healthcare question, so you'll be able to answer. And the next question, just speak up a little bit more, just for audio issues.
Oh, okay.
All right, next up is David Hill.
Okay, thank you very much. Great question. And it's a very important question. I've spent a lot of my career working on providing high quality, accessible healthcare insurance for employees. And so I've gotten to deal with Obamacare and the results of that. You know, the Democrats produce a solution for our healthcare problems, and that's one word: socialism. They want the federal government to take over all healthcare and to have a single payer system. I can tell you that is a terrible solution that would destroy the greatest healthcare system in the world, the American healthcare system. People fly from all over the world to come to America to have surgeries and to have their problems solved. America has solved so many of the world's healthcare problems, and it would be a disaster. We've seen that beginning of that disaster. Obamacare was one step towards socialized medicine, and it drove our insurance premiums sky high. It reduced the choices that we have. And so we have to employ the same things that made America so great, and that is freedom, innovation, competition to fix the problems with our healthcare system. I've had experience doing this. I've done this in many good companies. And again, if we rebuild jobs, if we have these high quality, high paying jobs with good benefits, it takes a tremendous burden off of our Medicare and Medicaid system. So there is a solution for this, and we can fix it.
All right, thank you, David. Next up is Janet Barresi.
Well, thank you very much. You know, before I begin, let me give a quick shout out to all the healthcare workers that are still working on the front line for those afflicted with the coronavirus. But let's make no mistake. Nancy Pelosi, AOC, and Bernie Sanders are focused on a socialized medicine model. So we have to fundamentally repeal Obamacare. That is critical. So let's talk about some solutions to our healthcare. First and foremost, most importantly, the patient has to be in control of their health care decisions. And that goes also to seniors and Medicare as well. Now, in this also, we need to have free markets be predominant in the solution for this. Yes, government has its role, but it's very critical that free markets that bring us innovation and research take the lead on this, because that'll produce efficient and an effective and a cost-effective system for us. We have got to have transparency and competition within this. I think it is absolutely critical that we have that. So if we focus on free markets and competition, less government is better government.
Thank you. All right, next up is Michael Ballard.
Okay, the late great President Ronald Reagan had a saying, and it was true then, it's true now, and it'll be true 30 years from now. The worst saying, the phrase in American English language is, "I'm from the government and I'm here to help." That being said, I think we can all agree that Obamacare's got to go. And that would help a lot. I mean, most people were happy with their doctors, their health care and everything that they had before. And we all remember one of Obama's many lies that if you like your doctor, you like your health care plan, you can keep it. I'm for the free market with being able to buy your insurance, not just in the state of Oklahoma, but to go outside the state, Texas, Kansas, we are supposed to be a free nation, a free constitutional republic. And as free men and women, we should be able to buy our insurance anywhere we want to. And another thing that I'd like to see, every time that we go to a restaurant or out to eat or to a store, the price is right there. So you don't know, everyone knows what the price is before you go to the checkout line to pay your bills. And with your, am I out of time?
No, go ahead and finish your thought.
Okay. With that being said, when you know what your the cost is to you, but with your healthcare system, you don't have any idea what your heart attack's going to cost you or whatever. And once you get that bill, if you didn't have a heart attack going into the hospital, you'll have one when you open your bill.
All right. Thank you.